It could happen to a parent, a relative, or a close friend. It could even happen to you. Every year, about 70,000 people over the age of 60 unexpectedly begin to have recurring seizures we know as epilepsy. For many, like Martha Goodway, there is no family history of the illness and no apparent cause for its onset.
I did not have a stroke. I did not have any precipitating disease, anything of the sort.
And like so many seniors who develop epilepsy, she is not aware of having a seizure, but suddenly feels dazed and confused.
Missing something, going from one moment to another and knowing that there must have been something in between. And that is what I think gives people the idea that we're always confused. Of course we're confused.
We've had patients who come in and say, my memory's not as good as it used to be, because they expect when they get older to have bad memory, and the fact is they're having these little periods where they're blanking out, and that's what they call their memory loss. So we've got to learn how to ask the questions better to this group of patients.
Many are surprised to find out that epilepsy occurs more often in older people than any other age group. Today, about 300,000 people over age 60 have epilepsy. It is a silent epidemic in the elderly because caregivers from the family home to the nursing home often do not recognize the more subtle signs of epilepsy or mistakenly ascribe the symptoms to the aging process.
Epilepsy in older people can be difficult to diagnose, mainly because the symptoms can be mistaken for other conditions that occur in this age group. Some of the signs of seizures could be as simple as a brief lapse of awareness or attention.
Symptoms of epilepsy in the elderly may include suspended awareness, confusion, lost time, wandering in total unawareness, hearing things, brief loss of speech, momentary blackouts, briefly distorted vision, confused speech, facial twitching, and sudden anxiety. The signs vary widely and may not always be epilepsy. The key is if the behavior occurs repeatedly and in more or less the same manner each time. A physician should be consulted when these signs are observed.
If people found me outside having a seizure, they might think that I was an Alzheimer's patient because I wasn't able to answer them questions properly, or I was wandering about by myself in the dark.
See you later.
Seizures occur when there is a temporary disturbance in the normal electrical activity of the brain. Convulsions are generalized seizures that involve the whole brain. But more common in older adults are complex partial seizures that involve an electrical disturbance in only a part of the brain, usually the temporal lobe.
The clinical presentation is different, so many physicians are not identifying patients even though they're having seizures. The problem here is that the after effects may be very long-lasting. After a seizure is over, the patient's function may be impaired for days, even a week or two. So they may be diagnosed as having Alzheimer's disease if they have a seizure once every week or two. Their overall function is impaired, and it's not being picked up that they're having these intermittent events that are the cause of it.
Well, I had a job a while back, and after that end of that summer, I had a whole summer with the job, and I was there.
See? You want me to call him like I usually do? To get his attention. Kevin? 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 Kevin, can you hear me? Kevin? Can you hear me? Are you okay?
Oh.
Can you hear me?
Oh.
Talk to me. Carol, can you hear me? Okay. It's okay. It's okay.
Excuse me. Oh, please.
You're all right.
Oh, I love you. Please, please. Please, I love you so much.
Okay. Okay, Carol. Carol? I know. Carol, you're gonna pull all your things off. Carol, you're all right, sweetheart. Carol, we don't want you to pull all your wires out, Carol. Okay? Let me go get the doctor so I can get you something to relax. All right?
Epilepsy was once considered mostly a childhood condition. But we now know that a person aged 70 is 4 times more likely to develop epilepsy than a person who is 20. Jim Conrad started having momentary blackouts when he was 69 years old, but it was not diagnosed until a seizure occurred while he was driving.
I had one of these little seizures, and I guess the car swerved a little bit, and my wife insisted that she drive, and I did not. I said, "Why? I'm fine." I really thought it was some reaction to some medicine I was taking.
Mr. Conrad is a good example of how patients are sometimes misdiagnosed. He was having spells of confusion. He didn't have overt convulsions. Without the right diagnosis, you can't direct the right treatment.
The rising prevalence of epilepsy in older people is directly related to the aging baby boomer generation. People are living longer, and more people today survive other serious conditions of aging in which epilepsy can be an after effect. Conditions like brain tumors, heart disease, and especially strokes. Bill Bedard recovered from a stroke, but a few years later started having seizures.
It usually starts with a visual disturbance right up here in this visual field. It's a bright spot that kind of dances. And then I start to get confused. And then I lose the ability to speak. If it progresses further, I start to convulse a little bit on my right side. I do this.
Many patients do not know that they're having seizures till well into the evolution of it, and it often is presented as a convulsion. That's hard to miss. Somebody falls down and jerks all over, but they may have been having these little staring spells for weeks, months, even years before their first convulsion when the diagnosis is then made.
You gotta watch Lisa. Off.
Can you hear me? What happened? Kevin, you okay? You okay?
Calvin, relax. Okay, I'll take that. Stay in the bed now. Stay in the bed. You already pushed the button. Let your head down. You okay? Yeah, Give me the button. Give me the button. Okay, Calvin. Calvin.
It's been pushed. Just in case. I'm going to push it again, okay? Because he pushed it earlier.
The problem is especially troubling in nursing facilities, where patients are more dependent on healthcare professionals. Recent nationwide studies show there are far more people in nursing homes who have epilepsy than previously has been estimated, and many are not being treated properly for the condition.
Epilepsy in nursing homes is much more common than anybody ever recognized. When you look at the number of people in a nursing home in the United States, we probably have close to 120 or 150,000 people with epilepsy in nursing homes right now.
Assisted living communities and nursing facilities already are beginning to feel the impact as the baby boomer generation now heads into retirement. Studies also indicate that even when patients are properly diagnosed, they are frequently over-medicated because the doses they're prescribed are based on dosing practices for younger adults. Such practices do not take into account metabolism changes that occur as we age. Treatment is further complicated by drugs older people take for other conditions, drugs that can reduce or increase the effect of seizure medication.
We're finding that in nursing homes, the doses are generally higher, probably in half of the people. We've also had a chance in a smaller sample to look at actual blood levels of these patients, and about half of the blood levels in people in nursing homes are higher than I think they should be.
Too much medication can cause as many side effects as no medication at all.
You know, I had an aunt who was in an assisted living, and I came in, she had started these epilepsy drugs. At one point, she had so much medication that she was falling all over the place, and I really had to fight to get that medication reduced, and then her quality of life did improve because that medicine was just too much for her to handle. But I had to really fight. The doctors wouldn't really look at that because they said, well, she's not having any more seizures, but she's falling all over the place.
When they're over-medicated, they'll be more tired, they'll be sleepier, they'll be dizzier, they may have more falls, they might have more fractures, they may need more restraints.
When I first started having seizures, I was afraid to go out of the house. If I hadn't had the love and attention of my husband and my family, I would still be ashamed to go out. But they were the ones who encouraged me that I did not have to stay in the house, that I was still the person before I started having seizures.
That is still another reason why it is critically important for caregivers to become more familiar with epilepsy in all its subtle forms.
So this is a very, very major healthcare issue, not only in terms of quality of life for the people, but also just in terms of healthcare costs. As our population ages, and because epilepsy is so common in the elderly, we're going to have an epidemic of epilepsy. We're going to see much more epilepsy in our population than we ever have before. Contrasting that, we've had very, very little research for epilepsy in the elderly. This has been a very ignored topic.
Everyone should enjoy the best possible quality of life, no matter what their age. And everyone can help by learning more about epilepsy, a common and treatable neurological condition that today affects 2.5 million Americans.